Welcome to Dog Health News. I'm Roberta Chadis, and the mission of this show is to bring as much good information about dog health to dog parents so that they can keep their dogs healthy. And today, I'm very, very happy to have a guest from New England Pet Hospice and Home Care. This is Heather Merrill, and she came all the way here to meet with us to talk about a pretty difficult subject. Welcome, Heather.
Thank you very much.
Thank you so much for coming today.
Good to see you.
So, the subject of hospice care and home health care for dogs and cats is pretty difficult. How did you come up with this idea and bring it to realization with a very inspiring concept, I think?
Well, it's really been a lifelong journey, I have to say. I started my life always loving animals from a very young age. We almost always had animals in my home. There was a very short window of time when we didn't have animals, and then I went out and found tree frogs or carpenter ants or whatever I could find in nature to become my pets. And then I went on a very different path. I became an attorney, a commercial real estate attorney. I practiced for 20 years. And during that time, I had two family members die at home with hospice care. One, my mother-in-law at 63, and the other, my grandfather at 94. And my husband and I were very involved in their care, and I was actually with both of them at the moment that they died. Those experiences always stuck with me, and the care of the hospice team was just amazing. I, shortly after my grandfather died, entered into a personal health crisis and really wasn't able to continue working as an attorney at that point. And a lot of things changed for me. And when I came through that, like so many people who have a major health crisis, I felt like, boy, I'm really thinking about what do I want to do with my life, and am I giving back enough to those I care about? And I started volunteering in human hospice. I trained my Samoyed to be a therapy dog and brought him to hospice. And I found that those, what was supposed to be 2 hours and often turned into many more hours a week, were really the most important part of my week. I felt like I could really make a difference in that time and change how people felt about what was going on. And so I started thinking about going back to school to become a hospice social worker, hospice chaplain. I didn't really want to go into the medical field, but something along those lines. And then one day, one of my really good friends had a dog with cancer and said, I don't know what to do. I don't know how to manage his pain. I don't know what questions to ask. I don't know what the symptoms are. I don't know how to talk to my children. And to me, it was a no-brainer. You need hospice care. So let's go find it for you. It never occurred to me that it didn't exist. I just assumed it was out there. And when we couldn't find it for her, that started me on this path. And I started talking to the pioneers in this field, who are, not surprisingly, mostly out in California, and said, okay, you need to bring hospice to Massachusetts. And they said, no, we don't. You're going to do it. And I said, don't be ridiculous. I'm an attorney. I'm not a veterinarian. I'm not a vet tech, which is a veterinary nurse. Who am I to do this? And it was a long time of them saying to me, it's okay. You understand the hospice model. You understand the concept. You have the drive to do it. And I spent about 2 years thinking about doing it, taking business planning classes with the Center for Women in Enterprise in Boston, business planning, visioning, all of that good stuff. And I also used to run a meetup group. I don't know if your viewers know about Meetup, but it's a great way to meet people. And I used to run a dog walking group, and we had about 100 members, and we would go and do off-leash hikes in the woods, sometimes as many as 4 or 5 times a week. And different people would come to different meetups, and the poor people, I would always grill them and say, well, you know, if somebody were to offer this service, would you want it? And when your dog died or your cat died, what was hard for you? What do you wish you'd had? And so I did a lot of processing through pet lovers and pet parents. And then ultimately took the leap of faith and started the business in 2010. We started seeing patients in 2011. We've now seen well over 150 animals in person with hands-on care. And in addition to that, we've served people by phone and email with advice all over the world, many people that way. So it really was a coming together of many different events in my life. And like many people, I think, in midlife, this felt like coming home. It felt like what I was called to do and what I was always meant to do.
Well, you're making me think of so many areas to ask about, but I'd like to just talk about this area first, which is aging pets.
Sure.
Everyone gets a dog or a cat, and they live a certain amount of years. It's a short window as opposed to humans, and then they have to deal with aging. So that's an area that I'm wondering if you can just talk a little bit about how to manage that aspect of owning a pet.
Sure. And, you know, we are both a hospice and a home care agency, so animals don't have to be imminently dying to come see us. A lot of animals that we help with are elderly or have special needs, showing some signs of changes. So we work with animals like that all the time. And it's really interesting. This past weekend, I was at the Mass Veterinary Tech Association annual conference, and they had a veterinarian who's a behaviorist talking about cognitive dysfunction in cats and dogs. And they actually start seeing changes in their brains as early as age 6. So we think about our elderly animals as those who are in their teens, but things are actually starting to change for them pretty early on. And so one of the important things is recognizing those changes, helping support them through health. There are some great supplements out there. Exercise is really important, just like us, trying to stay a good weight. All of those things are really important for promoting the health of animals. And there is a lot we can do to prolong them and to keep them happy and comfortable and active for longer. So I always like to tell people, you know, some people are a little afraid of the word hospice in a name, and I say, you know what, they don't have to be imminently dying, and B, it's never too early to get involved because there's a lot of things we can do to help support them and help them age gracefully.
Now, are there questions that our audience might want to know that they should ask their vet when their dog starts showing some symptoms of aging that they are concerned about?
Sure. So some common symptoms of aging are urinary incontinence or bowel incontinence, having accidents in the house where they didn't usually. Sleep disruption is often a big one. So animals who are now waking you up at night who didn't do that, who normally slept through the night, sometimes vocalization, any kind of abnormality in their gait, so any kind of limping, even if it's slight, trouble getting up and down stairs, jumping on and off of things, those are all signs of aging. And one thing that's really important to remember is that you don't have to just accept that and live with that. There are actually very good treatments that can help not only, in some cases, overcome them, or other cases, mitigate them, so that it doesn't have to be a downward spiral. Some people assume, well, he's getting older, this is just the way it has to be. And that's not really true. So when you notice changes in your animal, don't necessarily just say, well, he's just aging. Say, I want to talk to my vet about this. This is what I'm noticing.
That's an excellent suggestion, really. I don't know if a lot of people think that way. So it's very good for our audience to keep an open mind, just like we would with an aging mother or an aunt or uncle that we might have to care for. So that's great.
There's a lot of things they can do to be helpful. So it's just really important to mention those. Your veterinarian is your advocate, and they have lots of tools that can be very helpful.
Now, Heather, I know you can't do all of this yourself. So let's talk a little bit about the team that you've built and how they help you do what you're doing.
Well, we're so blessed to have an incredible team. We have 25 staff members currently, and many of them are veterinary technicians. Our vet techs all have at least 5 years experience, but they average about 15 years experience. Yeah. So they've been doing this a long, long time. Most of them have experience in ICU and ER at major hospitals. So what's fundamental fundamental to what we do is a team approach, and it's called an interdisciplinary team, which is the same as what's in any human hospice or palliative care service. So we address not only medical needs, but also psychosocial, emotional, and non-denominational spiritual needs. So we're not a religious organization, but every human hospice and palliative care service has a chaplain on their staff to be available for those kind of questions, and we do too. So we have veterinary technicians, we have what we call animal care specialists, who are basically like home health aides. We have an interfaith spiritual advisor who's like a chaplain. I am a social thanatologist, which means I help people deal with death, dying, and bereavement. We have groomers on staff who come to the home and do grooming. We have a certified small animal massage therapist. We have several staff members who do Reiki work. So we have a wide range of services. And the idea is that no one person can be competent in everything that's needed in this situation. So we each do what we're the best at, and we're available to the family to make sure all of their needs are met. A really important concept in hospice and palliative care is that the patient is the entire family, and that's true in human work as well as animal work. So we're there to support the animal, but also to support the entire family, including the adults, the children, and the other animals in the home.
This is very true, and I know I've dealt with a lot of people who have just lost their pet. And it's just traumatic.
Absolutely.
And you wonder, what are they dealing with? And some of the things that I find, they're dealing with the loss of love.
Absolutely.
Just to have that animal with them, to be a companion, to love, to take care of. The responsibility for the pet is gone. And what other things do you find?
Well, there's not a lot of social support for pet loss and grief. And there is quite a bit of grief research on pet loss in thanatology. And what they found is that the active stage of mourning a pet is actually about 9 months.
Oh my.
So it's a lot longer than people think. And the reason behind that is you have to see the changes of seasons and the holidays. And we always took our holiday card at the lake in the summer, and we always did this now. And this is the anniversary of when we first met him, and this is when his birthday is. And so all of those things bring up grief, just like in human grief. So generally we say in human grief that the most intense period of mourning is about a year. So it's not that different. And people don't get that appreciation. Your boss might let you take the afternoon off from work, but they expect you to be at the desk the next day. And your best friend is happy to comfort you and lend a shoulder, but 3 weeks later, if you're still crying, even she might say to you, gosh, are you okay? Like, why are you still crying about this? When the reality is we grieve for a long time. And so that is both surprising to the pet parent who loses the animal, like, what's wrong with me? Why am I still so upset? And frustrating. Why doesn't anybody understand this? I don't have the support that I need socially. Very difficult.
I know for years, and I'm not exaggerating, whenever I saw a golden retriever, it would bring tears to my eyes because of my own dog. And I'm sure that people feel that way. It's a really, it's just an emotional attachment that you have, and it brings back all kinds of memories. But there are a lot of things that you can do, and I'm glad that you talked about that, especially writing stories about your dog and maybe making little tributes and things like that.
Sure. Every culture and every time has a funeral ritual. All the way back, we have evidence of Neanderthal man having funeral rituals. The fact that we don't have a ritual around our animals dying is very difficult for us. We feel like we haven't properly honored them. We haven't had a real public way to grieve. We don't have sort of an ending to that period. And so we really encourage people to do what feels right to them. So for some people, it's a funeral. It's a family gathering. For other people, it's a walk in the woods. For some people, it's writing a story, drawing a painting, writing a poem, whatever it might be that feels right to you. But we're left with this emptiness when we feel like we didn't really honor the death. And we didn't really take time out of our lives to stop and say, this is the time when I'm going to think about my animal and how sad I am that he or she is gone, and this is what I'm doing to honor them, and how important that is for all of us.
And of course, now I'm thinking about the whole process of saying goodbye to a pet, whether it be a dog or a cat. And I'm wondering what your team and you have to deal with for end of life for the pet. What is that like? How do you deal with the animal and the owner?
Well, one thing that we stress is that every animal is an individual. So we can have animals who have the same disease, the same stage, the same symptoms, and one will say, I'm not doing this, and pass away very quickly, and others who will fight on. So you can probably think about the animals in your life, who was, we might say, wimpy, and who was stoic, and who had a real zest for life, and who was just tired. And so one of the things that we stress is that there isn't one right answer for all animals or for all families. You know, we have to find the answer that's right for this animal and this family. So we do a lot of work around, how do you think he feels? Does he or she want to live? What does he enjoy? Can we bring more enjoyment into his life? You know, all of us, as our lives progress, we can't do all the things we used to do. When we're young, we can't do all the things we can as adults. When we're adults, we can't do all the things we could when we were young. That's just normal. We can't all do everything at every age. But we find pleasure and enjoyment in new things, in different ways. And so just because your animal can't go out, your dog can't go out in the backyard and play ball with Jimmy all day long, doesn't mean he doesn't enjoy curling up in the fireplace and being stroked. Not in the fireplace, near the fireplace. We don't want anybody in the fireplace. So what we do a lot is, what's his temperament like? What does he or she enjoy during their life? Can we introduce some new things that are pleasurable and see how he's doing, and then assess? And we really emphasize to our clients that to trust your gut instinct. Nobody knows your pet better than you do. Nobody. You live with your animal. You know what's going on. And your gut instinct is not some fantastical psychedelic kind of thing. It is an amalgamation of many pieces of objective criteria you're taking in all the time, and you don't even realize it. What's he doing with his ears? What's he doing with his tail? Is she rolling over like this? Is she as enthusiastic about her food? All these little pieces of information that you don't even realize you're taking into come together in your gut feeling. And then you can't sort of explain why you feel that way, but you have that gut feeling, and we tell people to trust that. Nobody in the history of humankind has ever said, I listened to my gut and I wish I hadn't. Boy, was that a terrible mistake, right?
Well, you're reminding me of a story that I think I was in denial about the health of my friend's dog, and I was asked to care for this dog and to spend time with this beautiful black lab. And I looked at this dog and I thought, no, this dog is not near death. But eventually he did die, and I just felt so good about spending time. So I'd love to hear if you have any stories you'd like to share with the audience that might help.
Sure. One of the veterinary technicians has been with us a long time, Betsy Hensley, who's a certified veterinary technician, also spoke at last weekend's conference about the role of the veterinary technician in hospice, and her words rang true for all of us, which is one of the most important things we do is give people time. You know, we help them make sure that their animal is comfortable. We let them know that we trust their decision, and we give them time to feel good about their decision, whatever it might be. And so sometimes we have animals. We had a dog that was sent home from the hospital, not expected to live through the night. They gave him really good pain control. We went to visit him. He couldn't get up. He had nystagmus, which means he can't see straight, so he was dizzy all the time. He was very weak behind. And he really just laid down and did not much of anything. And nobody expected him to live through the night. And he went on to live another 2-3 months. And it was really his will. He loved his family, and they doted on him, and they played with him, and they took outstanding care of him. And he just powered through it. And the dog just said, "This is not my time. I am not going now." And just powered through it and came back in a way that nobody expected. He was able to stand up again and walk and go to the bathroom by himself and eat normally. So we see all the time animals being very clear with us about what they want. And often it is, "I'm not ready to die yet. I have more good time." And usually the thing that they want the most is to spend their time with their family.
Of course.
It's so important to them. And they can lose lots of other things, but being able to spend time with their family is so critical.
And I know there's a definite surge of cancer in dogs, which is not always easy to know. Cancer doesn't just pop up and announce itself. So it might be interesting for our viewers to understand what some of those signs might be, and how to possibly deal with that when your veterinarian says your dog has cancer.
There's good news and bad news about cancer. The bad news is obviously we're seeing more of it. The good news is the reason why we are is because our animals are living longer. So we didn't expect our animals to live this long before, and now they are. And we have great specialists in cancer. We have veterinary oncologists who are really good. And animals do much better than we humans do with chemotherapy and with radiation. And so sometimes people say, "Oh, cancer, chemo, I'm not going to do that to him. He's going to be sick all the time and lethargic and lose all his hair." And usually that's not the case. Usually they do really well, and we can get them into remission and give them more time. So one thing I would say to people is don't be terrified of this diagnosis, because there is often a lot we can do. That being said, there are so many different kinds of cancers that they present themselves in different ways, but things to always be alert to: nausea, vomiting, diarrhea, blood in stool or vomit, pain, discomfort moving, discomfort in the way if you watch them and they're laying down and looking kind of funny how they're laying down, maybe something's inside that's hurting, swelling in joints, which could be an osteosarcoma, a bone cancer. So again, it's the same really things that we talked about before. Is if you see your animal exhibiting behavior that's not normal for them, time to go to the vet and get it evaluated. Because just like in human medicine, early intervention, early treatment makes a huge difference. And a diagnosis of cancer is not a death sentence. It's we need to do something about this. He may have limited time, but we may be able to do something about this to keep him comfortable for a longer period of time.
Now, before we go on any further, I think it would be also a good thing for our audience to know is how to reach you and where you are. Are there different locations?
Sure. We're an entirely mobile service, so everything we do is in the patient's own home. We do meet clients if they'd like us to at the vets or at the vet hospital or in the ER, wherever they need us, we will be. We don't have a facility. We are based out of Sudbury, Massachusetts, but we have our staff strategically located in many areas. That's part of why we have such a big staff, so that they can be close to their patients. So we do always assign a primary care nurse to every patient, and we try to have them within about 20 miles of their patients. So we currently service all of eastern and central Massachusetts, Cape Cod and the islands, all of Rhode Island, and southern New Hampshire. And those are areas where we have staff on the ground and we can come and provide hands-on care. In other areas, we do provide consulting by phone, by Skype, by email, by text messaging, by however people need it.
Right.
So we are able to service people literally all over the world with those services. But hands-on care with our staff is limited to a good portion of New England.
That's wonderful. And I know that you brought a few pieces of information to show that our audience that you have.
Sure.
I'm looking at one of them now for pain monitoring.
We do. Pain is always a really, really important piece of the puzzle. We never want any animal to be in pain at any time, including at end of life or just in aging. And we have a lot of really good pain medications, alternative tools. We use a lot of acupuncture, heat and cold like humans, physical therapy, passive range of motion. There's lots of things we can do to address pain. But one of the first things we need to do is be able to assess it. And we use this scale. This is the Colorado State University Pain Scale, which is one of the highly regarded scales in veterinary medicine. And what we like about it is it gives us some pictures. So it shows us what an animal might look like. This one here is for cats, as well as some behavioral issues, response to palpation, in other words, response to touch, and body tension. So animals, just like human beings, when we're in pain, stiffen up. They get worried looks in their faces, just like we do. So lots of people know that animals mask pain, but they don't understand how to look for it. And so in addition to trusting your gut, we do a lot of education around how to judge pain, how to assess it, how to take vital signs. An increased heart rate and increased respiration rate can be signs of pain. So we always want to be vigilant about pain. It's very, very important to us. And when we visit a client family, every client that we visit for an initial consult gets education on how to assess pain, how to evaluate it, and what to do if you see it.
So this is very interesting, Heather, because sometimes when you see the word hospice, you think immediate death, and which is very hard to think about. But it sounds to me like you're doing so much more. You're helping people to get through the process. You're also helping people to lengthen the life of their pets. So is there anything that you would like to say to our audience to just give them some words of wisdom or a tip, something like that?
Well, I mean, one of the most important things to recognize is that it's never too early to seek us out. We talked about earlier that animals show changes in their brains at the young age of 6, and they can show signs of pain throughout their life, and there's a lot we can do to manage that. So don't be frightened by the word hospice. We are also a home care agency. Interestingly enough, in human hospice, people actually live on average 11 days longer when they're receiving hospice care than when they're home, when they're either pursuing aggressive treatment in the hospital or home receiving not additional care. And we absolutely find that to be the case with our patients also. They live longer, they do better than anybody expected, and the families feel much better about the care and what they've been able to accomplish.
I think that's great. And one of the things that I'd like to give you today to wrap up our show is a book that I wrote about my dog.
Oh,
Good boy, Jesse. So that's my gift to you.
He's beautiful. Thank you so much. I will enjoy reading this.
It has an audio, so you can just plug that right in your car and listen on the way home.
I have to say I have too many books on my bookshelf to read, but I do listen to books in the car all the time. I'm on the road
really
a lot.
Helpful just to say thank you, and you can share that with some people that might benefit. But Dog Health News is really happy to have had you as our first guest here to share some little hard to take aspect of owning a pet. But I am delighted to have you here, and I hope people will reach out to New England Hospice.
New England Pet Hospice and Home Care. You can find us on the web, www.nepethospice.com, and there you can contact us. You can sign up for our newsletter. We do write a newsletter twice a month with substantive articles. If you would like any of our tip sheets, more information, a copy of the pain scale, just drop us a line. We'll be happy to send it along.
That's great. And I want to thank you so much.
You're welcome.
Very much. And I want to thank our audience for watching Dog Health News. And you can find us at www.doghealthnews.com. Thank you.